what's nice about our conversation is that my experience has focused a lot on psychedelics and offering psychedelic assisted therapy to patients, which I view as a catalyst for the therapy process. And you come from a more traditional therapy background. I'm wondering, if in your work you hit dead ends sometimes that you feel, might be sort of helped using, altered states of consciousness and experiences like that. Do you have any experience you can share?
Yes. So I'll share a bit of personal experience and a bit of clinical experience. And I think this is such an important question, whether you're a clinician or you're just somebody who's curious about these things, because I do think that's a question people often ask. It's like, when is it appropriate for me to explore this? Like, am I the right fit? And obviously, there's a lot of nuance there, but I will share for me how psychedelics have played a role in my healing. And then I'll talk about some clients here um, I had been doing various modalities for quite some time to work on traumas that I had from childhood, through teenage years, and was working really hard, was doing all the things I was supposed to be doing, and almost felt like there was an itch I couldn't scratch, like something I couldn't get to, that I had an inner sense or an inner knowing that there was more there, but no matter what, just couldn't quite get to. And that was the point where I began discussing, a different treatment approach in my mental health to help me access something that I hadn't been able to previously. And it was life-changing for me, absolutely life-changing. And I think between myself and the therapist I was working with, had I not trusted myself and had I not had a supportive person who trusted my own gut feelings about things, I maybe wouldn't have had that opening given to me. And I say that because this is something I've heard so frequently in my practice working with survivors, is like an inner knowing that there's more that you can't quite get to, or there's just a block of something that you can't quite get around. But if you don't trust yourself, you haven't done that work to really trust your body and your sensations and your feelings, that's a lot harder. And if you don't have a clinician who's open to, or at least somewhat knowledgeable about there being other options other than traditional therapies, even somatic therapies, outside of that, then you may not have that opportunity to go down that path. So I'm so grateful for that. With clients where I've given referrals or had folks come